demonstration of the patient assessment system is based upon the following scenario. You and a fellow wilderness first aider are hiking along in the nearby mountains on a chilly, overcast December day. About 20 minutes ago, two hikers passed you by, and one of them did not look well. As you continue hiking, you come across the pair stopped off the side of the trail, and one of them tells you that his friend, a 25-year-old male, has just collapsed and is now unconscious. The first part of the patient assessment system is the scene size-up, which includes checking the scene for safety. Once the scene is safe to enter, be sure to don the proper body substance isolation or BSI, such as non-latex gloves. As you approach the patient, formulate a general impression of the scene. Your general impression should include the number of patients, your overall impression of how bad things look, and whether or not the patient may have a head, neck, or spine injury.
As you're forming your general impression, if you see anything that would lead you to suspect a head, neck, or spine injury, you want to have your fellow rescuer immediately hold C-spine.
Now, on to the primary patient assessment. Open the airway using the head tilt, chin lift maneuver if no head, neck, or spine injury is suspected. Otherwise, use the modified jaw thrust maneuver. Once the airway is open, assess for adequate ventilation by looking, listening, and feeling for breaths and adequate chest rise for 5 to 10 seconds. If this patient is not breathing, then begin CPR immediately. Next, simultaneously check the patient's carotid and radial pulses, and take note of the strength and rhythm. It should present as strong and regular. Next, pull back your glove to expose the back of your hand in order to assess the patient's skin condition. This is best done on either the patient's forehead or arm. Now check for major bleeding by performing a head-to-toe blood sweep. Do this with your gloved hands. Place your hands under each section of the patient's body and then check your hands before continuing on to the next section. Be consistent about looking at your gloves for blood. Severe bleeding is a life-threatening condition and should be treated immediately. The patient's disability refers to his or her level of responsiveness and the evacuation potential. Assess the patient's level of responsiveness using the AVPU scale, working your way down from alert and oriented to unresponsive. Your patient's evacuation potential should be based upon the severity of the illnesses or injuries found. Your decisions can change, but now is a good time to make a judgment on which of the 3 evacuation potentials your patient may be: stay and play, load and go, or snap. Expose the patient to examine all major injuries while taking care to protect him from exposure to the elements. Now that the primary patient assessment is done, all life-threatening conditions have been found and addressed. It is now time to assess the patient for any additional injuries. The secondary, or focused, patient assessment is an opportunity to do just that. If the patient is conscious, or if an unconscious patient's friends or family members are present, then ask the sample patient history questions of them. Be sure to take a full set of vital signs, which should include heart rate, respiratory rate, level of responsiveness, and skin condition. Now perform the physical exam. Start at the head and work your way down to the feet, palpating as thoroughly as possible, looking for deformities and depressions, open wounds, tenderness, and swelling. When assessing the head, check the mouth for any airway obstruction such as broken teeth. Check the ears and nose for cerebral spinal fluids, and look for bruising around the eyes and behind the ears, which could indicate a head or brain injury. Check the neck and throat for jugular vein distension, tracheal deviation, medic alert jewelry, and then feel the vertebrae in the neck, looking for the bones to be in a straight line. Check the chest for stability, deformed ribs, or any other abnormalities. Ask your patient to take a deep breath, which will allow you to check for paradoxical movement. Also check the sternum to be sure it is in one piece. Check the abdomen by using a 2-handed roll to look for rigidity and point tenderness. Watch the patient's face for grimacing and guarding as you assess the entire abdomen, as there may be a pain response from the patient at a certain point in this assessment. Check the pelvis for stability and pushing down on the hip bones and then squeezing inward. When assessing this, the pelvis should hardly move, and you should hear no crepitus or bone grinding. Unless there is an obvious injury to the patient's groin, there may not be a need to physically examine this part of the body. Next, check both legs for any abnormalities, then move back to check the arms as well. Before rolling the patient to assess the back, check for CSM, which stands for circulation, sensation, and movement. This can be accomplished by checking for a pulse, pinching the same digits on both extremities simultaneously and asking the patient which digits you are touching in order to assess sensation, and having the patient wiggle toes or squeeze your hands to assess movement. Be sure to check both extremities simultaneously for the most accurate assessment. Now for the last part of the focused assessment, rolling the patient to check his back. Extend the patient's arm that is nearest to you above the head. Do so by grasping the patient's shoulder and belt at the hip, but never the belt loops, and slowly roll the patient towards you, resting him up against your knees. Now check the entire back from head to foot, and be sure to walk your fingers down the patient's spine, looking for any abnormalities. Before rolling your patient back into the supine position,